This is probably one of the best conferences I've been to, and I think because the model is very much about enabling people to share ideas.
We could sit and actually have dialogue with the presenter and with other members of the audience was really, really useful.
Face-to-face interaction really matters.
It's been about bringing people together, irrespective of their walk of life, irrespective of their interest.
We've discussed social bonds with one set of individuals. We've talked to Macmillan about how we might actually integrate services and move forward.
It's just a perfect opportunity to meet people who are making decisions at a CCG level, and people who can really bring about massive change.
We start to meet the commissioners, we start to meet the more senior management level within the hospital organisations and the commissioning groups, because these are the people that we need to start writing the cheques, basically, to start to adopt this technology.
Key influencers, key decision makers here, and they can really help us understand what our role in supporting the NHS is going forward.
Ultimately, our success is directly tied to the success of the NHS. If we don't find a sustainable model for the NHS, the private sector suffers. We need to work in close partnership to address these challenges.
Innovation is the lifeblood of any successful industry.
On display here are two types of innovation. There's the innovation that comes from applying more broadly the good stuff that is going on in particular parts of the country. That idea that if the NHS could everywhere do the best that is going on somewhere, then we would have the most fantastic health service imaginable.
What people have said is, we now know and we understand and how exciting it is to actually see it in practice.
It genuinely is about people ensuring that people on the ground actually come up with the innovations and the ideas that will actually really improve the NHS.
The second type of innovation is the idea that actually there are lots of interesting stuff coming down the pipe, a lot of which are spilling over from other parts of our lives, from technologies, and we've got to find a way of harnessing that, getting ahead of that curve rather than just letting it wash over us.
Despite almost 60% of adults in the UK owning a smartphone and using it in every other walk of life, only 2% of the population has had any kind of digital interaction with the NHS.
It's looking at digital channels, it's supporting that shift that we're seeing in the industry and other industries as well. I think the time is right for NHS, health and social care, to adopt those trends that are happening in the markets as well.
The UK's digital health industry is set to grow by almost $1 billion in the next 3 years, and it can be part of this mission, empowering patients, driving efficiencies and generating revenue.
I've seen examples of where real-time sharing of data is possible, where real-time sharing of information with patients is possible.
We've listened a lot. We've met a lot of great people, stakeholders across the whole healthcare continuum. And it's an area where we want to explore further as we go forward, and we're committed to coming back next year and supporting the NHS agenda here.
I'm hoping to come back with a group of colleagues because I think this would be something that we would learn a lot from. Sharing good practice is something that everybody in the NHS has benefited from.
Next year, be here. Next year, share the buzz.
I'm really impressed with Expo. It's the first time I've ever been. I'll certainly come to the next one.
Thank you so much. I declare the exhibition over for 2015.
Watch the space. We'll be back here again.